We're here at Nicklaus Children's Hospital in the Heart Institute, and there's a little 13-year-old girl who arrived from Haiti a couple of years ago who has a very, very complicated lesion in her left ventricular outflow tract and aorta, a ruptured sinus of Valsalva into her left ventricle, which is extremely rare, and the anatomy is extremely complicated.
So our goal for every one of these operations is to reduce the total trauma to that patient. And there are three critical structures wrapped around the defect in her heart: her coronary arteries, her conduction system, the electrical system of her heart, and the aortic valve leaflets. So I have to walk through a little minefield and not touch any of those critical structures and still be able to close this hole inside of her heart.
And being able to do a CT angio on her heart, print three-dimensional models with the Stratasys digital anatomy printer that we can actually operate on and cut and sew, we find that the technology is enormously powerful.
Now, I had been thinking about a different approach, and this model has just changed my mind on that.
And so even before we printed the first heart, we started looking for a virtual reality, augmented reality, now mixed reality solution. Found a wonderful vendor who's a full partner of Microsoft, VSI Appleclar in Germany, who has a fantastic mixed reality solution.
So I think the amount of information I can gather from multiple images that have different parts of the heart present or absent is profoundly useful.
Are you Rosemary? I'm your heart surgeon. I'm Dr. Burke. Nice to meet you. How you feeling? Yeah, I can imagine. Well, you're very beautiful. Nobody told me how pretty you were.
I don't think Rosemary understood what she had in terms of her heart problem until we gave her the model, until we showed her with the HoloLens exactly what the issue was. She's a very smart 13-year-old, beautiful little girl. She understood and understands why she needs open heart surgery now, and the surgeons understand better her very, very complicated anatomy.
I'm a little nervous, but at the same time not, because I know I'm in great hands and they're gonna do a great job.
Basically, what I was able to do with the HoloLens is they gave me X-ray vision, so I could see inside the baby's heart, which we normally can't do. So that's like being Superman for a few minutes. And constantly remind yourself to be gentle to somebody's baby, somebody's child.
That's the fulfillment of what we perceive as our duty.
It's lower down, and it's like right about here. I have to get this stuff out, and it's right under the annulus of the valve. I'm just going to shut up and do it. This might be a game changer.
Warm the room up a little bit.
That's real good. It's good room pressure. It's perfect.
The entire team does whatever it takes to take care of these children and their families to the absolute best of their abilities. And I think that shows in what we did today, why we form industry partnerships, why we're partnered with Stratasys for the 3D printed models, why we're partnered with VSI, Appleclar, and Microsoft for the HoloLens holographic 3D technology. I don't think anybody else in the world sees the synergy between these two technologies, the imagination and innovation and transformation that defines the Nicklaus Children's Heart Institute that we've shown for the past over 25 years, I think is one of the defining aspects of the care that we give to these children and to their families.